The National Association for the Education of Young Children is an organization committed to ensuring high-quality early learning for all young children. NAEYC has an established set of standards, one of which contains criteria related to health. The standard includes the following areas: ensuring nutritional well-being, maintaining a healthy environment, promoting and protecting children's health, and controlling infectious disease. Health is described within as a state of complete physical, oral, mental, and social well-being, and not just in the sense of absence of disease or illness. This also includes providing an environment that is safe from hazards. While it is important for children to explore and develop independence, they must do so in an environment that is safe and that makes them feel protected. This standard is foundationally important for programs to implement fully, because if children aren't healthy and don't feel safe in the environment in which they spend so much of their time, they will not develop the other skills that they need, such as, but not limited to, social, emotional, motor, language and literacy, and early math skills. In order for a child care center to create a healthy environment, they must first understand what this means. The standard explains in detail for child care providers what a quality environment exhibits in regard to health and safety, and aids in the establishment of processes related. For example, an administrator may not know that it is unsafe to microwave a child's meal in a styrofoam container. After reading through the standard, an administrator can make it a practice and train kitchen staff and teachers that this is not allowed. There is an abundance of information for child care centers, all of which promote a safe, healthy environment. The standard touches on and gives the do's and don'ts for maintaining health records, partnering with health consultants, staff training and best practice in how to respond to illness, safe outdoor and water play activities, diapering, safe sleeping, and feeding of infants, best practices for improving meals and nutrition to children, and best practices in maintaining cleanliness. There are also assessment items for the standard given in table form which might be useful as a checklist. A program can take all the knowledge gained in these areas and base training processes and procedures off of the information given. One of the most important aspects of a child care center is in caring for the infants, who are completely incapable of taking care of, feeding, and learning to make safe choices for themselves. One action I would take in a child care center to promote the health and safety of the infants is to ensure that there is never anything in the crib with the child, and that the child is always placed on his or her back to sleep in their assigned crib. This will reduce the risk of SIDS and prevent choking and or strangulation. Feeding is also another area of concern for infants. Infants under the age of 12 months should never be fed in a propped position and always held by an adult. Once fed, the teacher will wipe the mouth to remove any excess saliva and formula. This will ensure the child is supervised while eating and reduce the spread of germs by wiping the mouth afterward. The next area for implementation that I feel is important is in regard to hand washing. We can keep everyone in the building healthier by implementing thorough hand washing procedures that we also teach to the children. This procedure will specify specific times that adults and children should wash their hands, and also the proper manner in which to do so. All staff will be trained on this procedure, and administration will follow up to make certain that this happens throughout the day. By simply educating ourselves on the information within the standard, implementing procedures, and training staff, we will ensure a safe, healthy, and sanitary environment for all children to grow and develop.